Hello, look, my name's Simon Cowap. I'm a GP and I'm going to be presenting the Mental Health Skills Training module along with my clinical psychology colleague Richard McBride at GPCE 2016. As all GPs know, mental health disorders are extremely common, and in fact statistics tell us that about 20% of the population experiences a mental health disorder in any one year, and of that, anxiety disorders are the most common at about 14%, followed by mood disorders at about 6%, and substance abuse disorders at about 5%. Sort of severe mental illnesses like schizophrenia have a prevalence of about 1%. Now you can see there, of course, that those numbers don't add up to 20%, which tells you that there is a lot of comorbidity, where a lot of people have more than one mental health disorder. And the other interesting thing to note about mental health disorders and their prevalence is they're actually most prevalent amongst the young. The highest incidence of mental health disorders is in the 16 to 24-year-old age group, and it decreases a little bit with every decade after that. So these are very common disorders, and they're also disorders of young people. Look, in many ways it's the same as any other condition. Firstly, we need to be aware of these conditions. We need to screen for them with a couple of simple questions when we're thinking they might be there. We need to assess them using our ordinary clinical skills. And then, we need to make a formal assessment and a management plan. And again, as with almost any other condition, but particularly here, it's very important to do a lot of education. It's certainly very important that patients understand both the nature of their condition and the treatment that you're going to advise. And again, not unique to mental health disorders, but it's also very important to involve, family and carers wherever you can. And I think, certainly most of the time we just use our standard clinical skills, but of course this is one area I think where the therapeutic relationship between doctor and patient is extremely important. Well, look, again, treating mental health disorders is quite similar to a lot of other disorders, where there are both very important pharmacological and non-pharmacological measures. And within those categories, there are a range of options. For instance, within non-pharmacological measures, I tend to think of very general, non-specific lifestyle factors like sleep and exercise and diet, which can be vitally important, as well as what you might call non-specific psychological measures like relaxation, training, problem solving, perhaps mindfulness, meditation. And then again, of course, there's a range of rather more specific psychological strategies like perhaps CBT, DBT, ACT, acceptance commitment therapy, and so on, which, we often might involve a psychologist to help us out with. And of course, while SSRIs remain frontline medications for a lot of the common mood and anxiety disorders we deal with in general practice, there are a range of other medications out there that, people will become increasingly familiar with, some new ones and some, renewed interest in some older ones. Look, I think what this unit offers is first of all a reasonably comprehensive overview of both the common and the serious conditions that we see in general practice. So first of all, there's a real focus on anxiety disorders and depression, where we look in some detail about assessing these patients in our practice and then managing them, because these conditions, particularly, the mild to moderate severity anxiety and depression, are essentially conditions that we manage in general practice. Now, of course, we may well involve allied health colleagues like psychologists and others, but they're likely to be, the management is likely to be led by a GP. So I think, it's a very useful and comprehensive overview of the management of these common conditions. And then we also do look at some of the more serious conditions, perhaps where it's highly likely that a psychiatrist or other specialist will be involved, like bipolar disorder and schizophrenia, but nonetheless GPs do play a vital role in both the recognition and the shared care and the medical management of these patients. So I think this, first of all, it's quite a comprehensive look at the sort of important and common mental health conditions we see in general practice, but it's also done very much from a general practice point of view. I think general practitioners have had a lot of input into the creating of this module, and it's going to be presented by a general practitioner along with a psychologist. So I think this is an attempt to have a fairly uniquely common sense, sort of ground up, nitty-gritty approach to how do we really deal with these things in general practice. And of course, from a practical point of view, this isn't an accredited mental health skills training unit with the College of GPs, so people completing it will be able to claim the higher rebate for doing their mental health care plans.